Good afternoon, everyone, and welcome to our event entitled A Perpetual Crisis, Reflections on Renewed Public Health Failures at the US-Mexico Border. My name is Carissa Novak, and I'm a program manager at the Harvard Global Health Institute. HGHIs remain committed to bringing together experts to evaluate the current situation on the ground at the US-Mexico border. For this webinar, we've partnered with the FXB Center for Health and Human Rights to convene experts to critically evaluate the current challenges faced by the new US administration and address necessary steps for establishing humane border policies. Our speakers will not only examine the more acute issues, but will also evaluate the systemic immigration policy issues that have led to decades of inhumane treatment upon arrival to the US. Before we get started, I have a few housekeeping notes. This event is being streamed through Zoom, and the recording will be made available on the HGHI website and YouTube page in the coming days. During the panel discussion, we welcome questions from the audience, which will be answered towards the end of the panel. Please drop your questions via the Q&A function throughout the course of the event, and we will be sure to address them. We've also enabled the chat function, which will be monitored by my colleague, Luke. Please be sure to set your message recipient to everyone. To get started, I would love for everyone to share where they are calling in from today, including the city and country. I am calling in from Marblehead, Massachusetts in the United States. With that, let me introduce you to our speakers today. Olga Byrne is the Director of Immigration at the International Rescue Committee and has over 15 years experience supporting and advocating for the rights of non-citizens in the US. At IRC, Olga oversees immigration and asylum services across IRC's network of 26 US offices. Prior to joining IRC, Olga was a senior researcher at Human Rights First, where she conducted research and fact-finding on US asylum and border policy. From 2013 to 2015, Olga launched an initiative at the Fordham Law School FX Center for Social Justice to improve policies and practices related to children in the context of migration. Olga was a 2011 to 2012 US Fulbright Schumann Scholar in the European Union, and from 2006 to 2011, worked at the Vera Institute of Justice on national programs to increase access to legal services for adults and children in the US immigration custody. Olga is an adjunct professor of law at Fordham University School of Law, where she teaches a course on migration. Dr. Yael Shaker is a historian of US immigration law and policy and the senior US advocate at Refugees International. After completing her dissertation at Harvard in 2016, Yael taught at the University of Connecticut and worked on humanitarian visa applications for clients of the Connecticut Institute for Refugees and Immigrants. In 2017 to 2018, she was a postdoctoral fellow at the University of Texas at Austin, where she combined historical research on asylum and advocacy on behalf of detained asylum seekers. Most of her recent work at Refugees International, including 2 reports directed towards the Biden administration, has focused on policy at the US-Mexico border. Since beginning at Refugees International in 2019, she has made numerous trips to both sides of the border to interview migrants and assess conditions. Eunice Rendon is the executive director of Agenda Migrante and a researcher in the National System of Researchers for Mexico's National Council of Science and Technology. Previously, Eunice served as the Deputy Executive Secretary of Mexico's Executive Secretariat of the National Public Security System. She has held positions with the Institute for Mexicans Abroad at the Ministry of Foreign Affairs, the Ministry of the Interior, the Ministry of Health as the Coordinator for Mexican Health Normativity. She has also been a consultant in different international organizations belonging to the United Nations system and was a fellow at the National Institutes of Health in the United States. And lastly, our moderator, Jacqueline Baba, is a professor of the practice of health and human rights at the Harvard T.H. Chan School of Public Health, the Jeremiah Smith Jr. Lecturer in Law at Harvard Law School, and an adjunct lecturer in public policy at the Harvard Kennedy School. She is also the Director of Research at the Harvard FXB Center for Health and Human Rights. She received a first-class honors degree, an MSc from Oxford University, and a JD from the College of Law in London. From 1997 to 2001, Jacqueline directed the Human Rights Program at the University of Chicago. Prior to 1997, she was a practicing human rights lawyer in London at the European Court of Human Rights in Strasbourg. She has published extensively on issues of transnational child migration, refugee protection, children's rights, and citizenship. She was the founding chair of the Scholars at Risk Network, and she serves on the board of the World Peace Foundation, the Institute for Statelessness and Inclusion, Fortify Rights, the Journal of Refugee Studies, and the Journal on Migration and Human Security. And with that, I will hand it over to Professor Baba.
Carissa, thank you very much for that very detailed and gracious set of introductions. And thank you and your colleagues at HGHI for putting together this important and very timely panel. I think many of us have followed immigration issues, including immigration issues at the southern border, for a long time. And many of us, I think, were and remain hopeful that the change in administration in the US is going to alleviate some of the extreme suffering caused by the previous administration. But the reality is that the factors propelling distressed migration from Central America, from the Northern Triangle countries, have not really abated. And we know, and I'm sure we'll discuss this, that violence, extortion, destitution, hunger, and then, gender-based abuses, gang recruitment, and so on, continue to make life really impossible for many poor communities. And the COVID-19 pandemic has only compounded the challenges that these poor communities face in their societies. So there's growing unemployment, there is a retrenchment of the informal economy, which so many people depend on for their livelihood. And there is a dramatic lack of any safety net of social security. So the end result is that migration is one of the only safe strategies for survival. It's not a willful choice. It's not a fanciful election. It is a hard elected or hard chosen option to survive and to support one's family. And so thousands continue to make this choice despite the known risks. And I think the migrants themselves are very well aware of them, as indeed many of us on this panel are. The risks during the journey, from just the hardship of the forced migration because the direct routes are not available because of migration control, the hardships that result from predatory individuals taking advantage, and then the additional hardships of harsh living conditions in camps, of lack of access to basic resources that people need for life, including during a pandemic, access to healthcare. And additionally, on top of all that, I think what we're seeing, and maybe we'll discuss this, is a move in the national population, and one of our panelists is in Mexico. We'll talk about this maybe. A move in some sections of the host population from a very warm welcome and a warm, generous embrace of solidarity to a more skeptical or sometimes even hostile reaction to outsiders when people themselves are challenged and are facing difficult times. So xenophobia and hostility is another one of the dangers that migrants face. So all this leads us to a situation where this incoming Biden administration has its work cut out for it. It has inherited a very complex and difficult situation. And I think what we are going to focus on today is the current situation. The title of our talk is Perpetual Crisis, but one might even suggest that this is a new normal. It's actually, we shouldn't really think of it as a crisis, because this is really what we should be expecting and we should be predicting and we should be planning for. So I think that we are going to talk about a range of issues to do with the border, to do with exclusion, to do with detention, to do with the treatment of families. And luckily, we are extremely well endowed with experts here on this panel, three really brilliant young women who have dedicated years of their lives to this issue. And so I'm not going to introduce them again because Carissa already did that. I'm just going to call on them, each of them, to make opening comments, and then we'll have a discussion. And then as we proceed, we hope that those of you who are listening, calling in from all sorts of places, including Brazil and Missouri, will add your questions to the chat, and so we can bring you into the discussion. So let me start with you, Olga. you have decades of experience working on refugee-related issues, and you work with one of the most prominent organizations involved in this work. Please give us your opening remarks.
Thank you so much, Professor Baba, and thank you also to Carissa for the warm welcome and introduction. It's great to be with everyone. I'd like to start by providing just a very brief overview of where we are in terms of seeing some of President Biden's policies begin to play out, or really not quite yet begin to play out at the southern US border. In his campaign, President Biden pledged to rescind the damaging policies of the Trump administration. And this was, politically popular for him to say, because so many were shocked by the policies of the Trump administration. Of course, the zero tolerance family separation policy had, not only Americans and people in Mexico and Central America, but really people all over the world watching in shock and in distress. And I think beyond that, more and more attention was given by the public to the Trump administration's cruel policies. I know, 10 years ago when I was working on these issues, people didn't really talk about asylum or unaccompanied children, and now it seems to be more of a, of household topics of conversation. So within just less than 2 weeks of taking office, President Biden issued an executive order that aims to both create a comprehensive regional framework to address and manage some of the root causes throughout Central and North America, and also to provide safe and orderly processing of asylum seekers at the US-Mexico border. But I think that safe and orderly processing of asylum seekers has arguably never really existed at the US southern border. And this is perhaps where the real challenge lies for the Biden administration. It's not just about erasing the policies of the previous administration that have caused so much damage. The Trump administration stepped into an already dysfunctional system. They just made an already harsh system much harsher by removing some of the elements that did exist to ensure some level of access to due process or to protection. So the executive order issued by the Biden administration a few months ago sets out basically a pretty basic initial plan for the border. And first, it calls for the review of some Trump policies, review and in some cases immediate rescission. So I'm sure you've all heard about MPP, which is short for Migrant Protection Protocols, but is more often called Remain in Mexico. This was the Trump era policy that basically said, sure, you can pursue a case to stay in the United States, but you can't actually be in the United States. You have to stay in northern Mexico. It wreaked enormous havoc on individuals and families who, while 99% probably have a relative or someone with whom they could stay safely in the community in the United States, they were forced to stay in areas in northern Mexico that are simply not equipped with the resources to properly receive them. And of course, there are a high level of safety and security concerns that continued to grow along with border externalization as more people were forced to remain in difficult situations. The executive order called for review of certain asylum bans that, kind of blocked access from a legal perspective of gaining asylum status in the US, the so-called safe third country agreements, which was another pretty shocking Trump era policy that basically allowed for the US to receive an asylum seeker from any country and then say, well, we're actually going to send you to Guatemala, where you can seek asylum there, to a country that doesn't have any functioning asylum system whatsoever. And these so-called safe third country agreements were immediately rescinded by the Biden administration. But, I think the question that many of us or most of us who work in this area have right now is, why hasn't the Biden administration rescinded Title 42? And Title 42 refers to a regulation that the Trump administration issued in March last year, just after the pandemic, really hit in the United States, under the authority of the Center for Disease Control, the CDC, and under the Title 42 references just the provision in the U.S. Code from which it gets its authority, that says that basically U.S. immigration authorities can block any entry into the U.S. whatsoever of somebody who's not a citizen or a green card holder. While it doesn't refer to asylum seekers, it is absolutely a block on asylum at the U.S. border. It is a broad and extreme measure that public health officials indicated at the time was not necessary to protect public health. And now, in particular, as we have a new administration and we have, a large percentage of the population vaccinated and so on, it's, eyes are very much on the Biden administration to ask why is this still in effect, particularly when tourists are crossing back and forth daily without being expelled. Just in the first 7 months of this fiscal year, to give you a sense of the scope, over 500,000 people have been expelled under Title 42 back to Mexico. Or I should say there have been over 500,000 expulsions. Some may be individuals who've had to experience that more than once. So finally, I will just say, I think that a key challenge for the Biden administration, if it is going to stick to its pledge to build, a safe, a fair and humane asylum system and way to receive people, is that there is a very strong inertia within the existing system to kind of continue doing what it has always done. And we have the agencies that receive asylum seekers and migrants at the border working under a law enforcement mandate, not a humanitarian mandate, and definitely not a public health mandate either. And I'll just give 2 examples of that. So with COVID testing, there is no COVID testing conducted in Customs and Border Protection, shockingly, nor in Immigration and Customs Enforcement. The agencies have said they're not equipped for it, and that's that's probably true. An example that we saw through my organization IRC in our Arizona office, where we operate a border shelter that receives people after they've been released, and also receives people who've been released from ICE custody. ICE meaning ICE immigration detention centers. Just during the transition, just before January 20th, when President Biden was inaugurated, we received several individuals. And when we looked through their paperwork, our staff saw that they had a document that said positive but discharged. And the individuals had not seen the document. They hadn't had a chance to read it or didn't understand it in English. And so it means that they were COVID positive and they were being discharged from detention. But the immigration authorities had actually brought them to a public bus station. And it was only through volunteers we collaborate with who happened to, to be there and say, would you like to come, to a border shelter for a night and we can help you arrange your travel, that we ended up receiving them. But the immigration authorities were prepared to leave them at a bus station knowing full well they were about to embark on probably a cross-country journey, in close quarters on a bus. And the second thing I will just say is that the US does not have a humanitarian reception system. Civil society actors have come together for decades on the US side of the border to receive people once they are released. And this is just out of the goodwill of faith-based organizations, volunteers, and NGOs coming together. But it's not actually a formal part of the US system. And so we only receive people who've been released, as in the example I just gave. If volunteers go to a bus station, from time to time, ICE or CBP might drop people off, but they're not required to do so by any law or policy. At the same time, civil society and NGOs have really built great systems to ensure everybody is tested when they do go to the border shelters, to ensure they get a legal orientation and know what they have to do next in their process, to ensure their travel is well coordinated, among other things. So I think, the Biden administration has opportunities to work with civil society to develop humanitarian and outcomes-driven models. And we very much hope that they don't continue to sort of give in to the inertia to stick to a more enforcement-centric approach. And I think I will leave it at that.
Thank you, Olga. Wonderful comments. And I have several follow-ups, which I'll come to later on, but that really set the scene beautifully. So thank you. Our next speaker is Yael Schachter, who is joining us from, where are you, Yael, actually?
I'm in Washington.
Yeah.
I'm in my apartment, but I'm in Washington.
Okay. Yael, I think you're going to talk a little bit more about the health aspects of this current situation, because of course we have a double whammy. We have a kind of the ongoing dysfunction and the legacy of a brutal administration, and then we have a pandemic and its ongoing impact, particularly on communities of color and poor communities. So yeah, your comments, please, Yael.
Sure, thanks. And it's really an honor to be here with all you distinguished folks. So I wanted to say first to echo one thing that Olga said, which is that I too am very, very worried about one of the other things that the executive order calls for is a review, for example, of a process called expedited removal that was in place before the Trump administration. You know, it's sort of part of the inertia. It's part of the enforcement process at the border that doesn't really provide a real fair assessment and reception of asylum seekers at the border. And I too worry that we're going to fall back into past patterns. So I couldn't echo that more. I wanted to pick up one thing on the title of this talk, you know, this idea that Professor Baba also mentioned at the top about, you know, is this sort of a crisis, a perpetual crisis, sort of what do we mean by that? And so I'm a historian, so I just wanted to say one word about that, which is that, you know, especially related to Title 42, which Olga mentioned. You know, there's a long history of sort of medical exclusion at the border based on nativism and, you know, seeing foreigners as like inherently diseased, right? Okay, so that's a long pattern in US history. And indeed, the law being invoked, Title 42, the statute, was originally proposed back in the 1890s. And it's clear that nativism and sort of seeing foreigners as diseased was sort of a motive there in that law. But what's sort of troubling is that, especially troubling, I guess, about Title 42 is that, you know, refugee and asylum law, as folks on this panel know, was really born in the late 20th century in the United States. And the kind of expulsion of asylum seekers that's actually happening under this provision is sort of in some ways unprecedented, you know, in that late 20s. We haven't been expelling people in this way, you know, since certainly 1980 in this kind of way. And what's even more troubling to me now is that the Biden administration really seems to be using this Title 42 as like a migration management strategy and sort of invoking public health for political reasons. But this is really seems to be more of a tool of migration management, which is, you know, today, just this morning, the head of Immigration and Customs Enforcement basically said to Congress that expelling people is necessary to leave room for socially distanced detention in ICE, because if we don't expel people, you know, we'll have to pack a lot of people into ICE custody. So there's so much presumed there. One, that you actually, it falsely presumes it's necessary to detain asylum seekers, you know, rather than use alternatives to detention, or to see that as sort of like, as Olga said, the enforcement element as key here. And that being driving, again, the use of Title 42 is really, really troubling. And in response to a lot of pushback, there is a sort of humanitarian exemption process being set up at the border that'll help some of the people who are especially vulnerable, including people who are vulnerable for medical reasons, to come into the country and not be subject to this. But this sort of process, you know, picks out the vulnerable, and it's not really a substitute for a real asylum system, for real reception at the border for people who need it. And in terms of health, it's also not addressing what Professor Baba mentioned, you know, the problem of a lack of healthcare for migrants, all migrants on both sides of the border. It's not enough to say, well, let the very sick in, and that's it, instead of sort of transforming the system into one that provides for humane reception and real care to migrants on both sides of the border. So I just wanted to say, you know, what we've been seeing during, on the health issues that Professor Baba was mentioning, what we've been seeing during COVID-19 And the Title 42 over the, imposition of Title 42 over the past year has been sort of an exacerbation of this problem of lack of healthcare for migrants. And it's actually partly attributable to the implementation of Title 42 itself, which I'll only speak a little bit about because I know Eunice is going to speak about this more. But, the way it works at the border is that migrants are picked up, or sometimes they're detained for a couple of days by the Border Patrol, so in terrible conditions. Sometimes they're detained longer by ICE before being expelled. So, if the idea is that you're supposed to expel people for public health reasons, detaining them for a couple of days in Border Patrol, sometimes detaining them for longer by ICE, and then expelling them to places in Mexico where they don't have access to healthcare, and sometimes expelling people who are sick and exporting the disease. I mean, you can see that this is sort of like a perverse and not really geared towards public health. And just a couple of examples, in February 2021, I sort of was following this very closely. There are African asylum seekers were coming in through Tijuana. They were being held in CBP custody for a couple of days without access to food, only to be expelled. Border Patrol agents were, there was a case of a Border Patrol agent who confiscated all of the Haitian asylum seekers' belonging, including, clothes for her young baby. While she was detained, she stayed in Border Patrol custody for a couple of days, only to be expelled back into Tijuana. She didn't have clothes for her baby. The baby developed an infection in Border Patrol custody. I mean, this is the kind of expulsion that's happening, just to give you a flavor of the kind of the public health consequences of Title 42 itself, of the policy itself, right? And in Arizona, in areas where, the IRC works too, I mean, there have been sort of these delayed detentions where especially people are being detained in ICE facilities for weeks sometimes before being expelled to their home country. So again, I just want to make the point that, and conditions in ICE custody, there had been at the beginning of the pandemic, conditions in ICE detention centers were poor. The ICE detention centers, as Olga mentioned, were not managing COVID very well. We're not testing. They're actually making things worse, sort of hot boxes of COVID spread. And so the numbers in detention decreased significantly, but they're on the rise again. So they're going up. The numbers had been down. We had gotten down to something like 10,000. It was lower, as low as it had been in decades, basically, of people in detention, because we have the capacity for over 40,000 beds, detention beds in the United States in ICE custody. So they had gone down significantly, and now it's sort of inching up again. I think we're at about 17,000 people in custody now, in ICE custody, despite the pandemic, right? And so this is a real problem. And then the exporting of disease and expelling people who have very, very severe medical conditions and who do not have then access to care in Mexico that they need. I just want to say on the Mexican side, and I know Eunice will speak about this more, what we see is sort of an exacerbation of problems where migrants cannot access basic care, basic health services, including pregnant women who can't access care, can't access neonatal care. There are even expulsions from the United States of women who have just given birth in US hospitals, women who are very pregnant, that kind of thing. And, in Tijuana, I know that, the public hospital is turning people away. It's maxed out capacity, and there's just a lack of access to care for the people being expelled there. And I just want to speak one last point about things happening on the U.S. side of the border. I want to, end with, the Biden administration is doing quite a bit of good work to get, as Olga said, to get it so that make vaccines accessible to people in the United States. I mean, we're starting to see those rise. Once people are actually in the United States, the Biden administration has been doing some to get money to FEMA, to get money to NGOs who can help when people are released by DHS at the border, to work on testing, to work on quarantine, as Olga was mentioning. Vaccines are obviously becoming more available, including for the undocumented, sort of essential workers, things like that. There's this push by the Biden administration to make sure that sort of migrant agricultural workers, they should have access to vaccines. I mean, there's work being done here to sort of get at populations, underserved populations who are hard to access. There's more programs to reach out to refugee and immigrant communities to make sure they know they can get access to these vaccines, including the undocumented. And perhaps, but I don't think this has yet trickled down to focusing on those coming in at the border, getting access to those vaccines. I mean, we've got a little bit of a ways to go there. Perhaps California could lead on this issue because it really has a more progressive approach towards vaccines. One other place that could lead on this issue would be the Office of Refugee Resettlement. And I know a lot of people have been hearing a lot about the progress that the Biden administration has made in getting children, unaccompanied children, out of CBP custody, the Border Patrol custody, and into these ORR facilities, these Office of Refugee Resettlement facilities, which are under the auspices of the Health Department, not DHS. And that's true. The numbers of children staying in Border Patrol are declining, but there are huge numbers of kids now in these ORR facilities. And the key is these are big influx facilities. The key is to sort of minimize the time the kids are in these facilities, get them to their sponsors. It would be great if the Health and Human Services Department would get them vaccinated too. That would be fantastic, before, so these are some of the things that I think we could actually do to sort of, okay, we're making progress on some issues, but where can we sort of push it even further and make progress further? And again, focusing on post-release services and funding for post-release services for kids rather than, keeping them detained in ORR facilities. I mean, post-release services, these kids who come here on their own certainly need those kind of post-release. So pushing away from detention and focusing our attention on services for people outside of detention would also be, I think, first of all, it'd probably be less expensive in many ways and do a lot more good for the folks coming in. I'll stop there. Thanks.
Thank you, Yael. Again, really rich comments and many really interesting things for us to unpick further from what you've said, which I've noted down a couple of. Eunice, really nice to see you again. Thank you for joining us from the other side of the border, and thank you for bringing the expertise and the really, really hard work you've been doing for these past months to us. So welcome, and really welcome your comments. Thank you.
Thank you, Professor Baba, and thank you to all the speakers, and thank you for the invitation. I would like to speak about this current situation in the border between the United States and Mexico, especially in Ciudad Juarez and Tijuana, in terms of social, economical, security, and health dynamics that we are already passing here. As Olga explained, despite the sustainability of humanitarian approach to human suffering of President Biden, and it is very different from Donald Trump, but in spite of that, he inherited a lot of very unrespectful and inhuman policies against migrants, and we heard through Olga and Yael explanations some of them. For example, MPP ended by Biden administration, and people that were under this policy are coming into the United States in order to follow their cases now in the state because they are asylum seekers. But we have Title 42 instead of MPP, so I think that is something that we have to be worried about. I've been working during the last months at the border, receiving hundreds of migrants every day from different Central American countries. They have been expelled from the U.S. under this Title 42 expulsions, by which the U.S. government, with the participation of the Center for Disease Control and Prevention, removes persons considered to be a risk in terms of public health for American citizens. This provision that comes from the Section 265, that are suspensions of entries and imports from designated places to prevent the spread of communicable diseases, was established during the Trump administration in March 2020 under the pretext of COVID pandemic, but nevertheless it continued, and it has been especially used by the Biden government. Since the first week of March, U.S. officials had been placing families who recently crossed the border in South Texas on planes and transporting them to El Paso and San Diego in order to expel them to Mexico from those locations to Ciudad Juarez and Tijuana. I've been very present in Ciudad Juarez all these weeks, and According to US data, US government data, more than 48,000 migrants traveling as family unit have been expelled under this Title 42. These numbers are until March 20, until this month of March of 2021. So actual numbers must be higher. But the main problem of this, or with this type of expulsions, is that the 80% of these people, of these migrants that are removed, are families that came with little children. So in terms of health access, in terms of even shelter and other services that they need, we don't have this capacity on that side of the border. On our side, the Mexican migration authorities cannot retain minors, neither alone nor accompanied, in their shelters in last year because the migration law was reformed. So therefore, civil society and local governments have been trying to address the situation with hundreds of migrants arriving every day. For example, in the case of Ciudad Juárez, there are 20 shelters already in their full capacity, some of them even with the double of person they can normally accept. And we have heard also about the conditions we have in some of these shelters. There are not very nice conditions, but when it's better than nothing, but we need more cooperation in order to attend these people. Central American parents who crossed the Texas border with children as young as 2 years old and tried to ask for US asylum, they said that they were detained in Border Patrol facilities for days, as we already heard with Jael's explanation, before being flown to El Paso and San Diego, where they expelled to Mexico. Some of them, without knowing, they were going to be returned to Mexico. And others decided by the US authorities, for instance, there is the case of one family for Guatemala, another for El Salvador, that they were told that they were going to be moved to another shelter at the northern part of the US. And when they realized that they were in Ciudad Juárez, they were devastated because in their minds, Ciudad Juárez is one of the most dangerous cities in the world. So people are very worried when they realize they are in this part of our border. Another problem among these migrants of Title 42, there is that there are cases that fulfill all the requirements for an asylum visa, and they are not allowing them to ask for it. So that is something that we have to underline. A lot of advocacy groups and lawyers are helping these people in order to do something. But the case that we are having now, the cases are that they are coming back they are expelled back to Mexico. When the US started expelling migrants under this title, they used to drop them in Mexican territory without previous notice to the Mexican government and during the night. According to some testimonials from Central American women that we were talking with them last week, some of them were very afraid because when they were expelled in our border, they were captured by criminals and raped and also abused. And one testimony of one of these women, she told us that she escaped because she used to be a police at Guatemala, so she can escape, but another woman cannot. Then both the Mexican and American authorities accorded to receive people in a special point on the bridge that connect the border. But what doesn't make any sense is that when the Mexican government claimed about the health risk for Mexico, the US responded that they had made PCR tests and no migrant had COVID. But as we already heard with Jael, that's not true. Some of these migrants that came to the shelters, they bring COVID to this shelter as well, and that is a very big problem now in Ciudad Juárez. The Biden administration has said that Trump-era order authorizing the expulsion is necessary in order to keep migrants from crowding government holding facilities and potentially spreading the coronavirus. But so the fact that families were held in Border Patrol holding facilities with other migrants and then placed on buses and planes undercut the Title 42 rules stated objective. And during a call that the Alejandro Mayorkas has, the Homeland Security Secretary has with a lot of reporters, he declared that he was taking a close look to these flights at the cross border, but we don't know what is going to happen and if the Title 42 is going to finish or not. In terms of health facilities and access, there is not a public health mandate or cooperation for attending these migrants. In Mexico, our system changed, and in the new system, they do not include migrants as we used to do in the previous one, and that is a very big problem. Now, some local governments, at Chihuahua, Ciudad Juárez, and other one, they help in some ways to migrants, but they don't have the real access. For example, some shelters have accorded with the government in order to have mental health facilities, because a lot of people had very bad traumas because of all the things that are happening, because they were separated also from their family. And I'm going to talk about later about this separation of their children. People is also afraid, so they do not go to these services because they are afraid of what can happen to them if they are going to be returned to their countries, and they are afraid also because of that. Group, for example, as ACLU, the American Civil Liberties Union, have progress in negotiation with the U.S. government to getting the most vulnerable families to safety through a variety of means, but it's going to finish until the Title 42 finish, no? In terms of little children, since President Biden took office, Border Patrol agents have encountered more than 2,100 unaccompanied migrant children who are believed to have left their families voluntarily in order to seek asylum. Here is something very interesting. As long as Biden opened the border for these little children, we have also a lot of testimonies. We learned about people that some families self-separate so their children can arrive at the border. So as they understand that they are not going to pass as a family unit, no, once they are returned to Mexico as Title 42, they put their children alone. So this also have a lot of implications in terms of mental health of the children, in terms of mental health of their parents, and other implication that we have to underline. So my last remark that I would like to do for this introduction is that Mexico is also having some negotiation with the states, because we have 10,000 troops along our border with Guatemala, but Guatemala as well have 1,500 police and military personnel on in the border with Honduras. So and Honduras as well have like 7,000 police and military dispersed to a contingent of migrants. So we continue with that kind of practices that we used to have with Trump. It's true that this another language that Biden approach, and language is more humanitarian, but we still have this inertia in some of the migration policies. And I think that if there is one population we have to look for, is for children, because are the more vulnerable phase of migration.
Eunice, thank you. Really terrific, very, very actually moving and upsetting information there, I must say, about these very large numbers of children. And also, you know, the kind of desperation of families forced to separate from their children. I mean, talk about creating an inhumane policy, forcing people on really dangerous routes because you close the safest and most direct routes. And then you close the kind of most humane way of seeking asylum as a family, and you force parents into these terrible choices. It's really such a cynical and rights violating approach. So thank you for those comments. So what I would like to do, I mean, our conversation is, unfortunately, we only have 15 minutes left and there are questions coming in. So I would like to just ask each of you one question and ask you to be brief, please, though I know you could talk at length because these are not easy issues. And then we'll talk collectively. So I'm just going to follow the order in which you already spoke, with a single question for each of you, please. So, Olga, you made the really important point that the US has no humanitarian system kind of provided by the state, no public humanitarian system for receiving asylum seekers, which is actually stunning if you think about it, if one compares with Europe or with other kind of advanced and wealthy northern kind of destination states, if you like. In contrast to the Office of Refugee Resettlement system that exists for refugees who've already been awarded refugee status. So this sharp contrast between the treatment of asylum seekers on the one hand and of already registered UNHCR certified refugees on the other is very striking. Is this something that's being actually actively talked about with the new administration? Because if you're talking about an ethical, set of policies, if you're talking about advancing the interests of early childhood development and families in a non-discriminatory way, this would seem to be a critical starting point. So I just wondered if you could, from your kind of insider knowledge working with the IRC, if you could tell us whether this is actually on the agenda and whether you realistically think this is actually going to go anywhere.
Yeah, it is 100% on the agenda, and the Biden administration has said they want to increase case management for asylum seekers. The problem is, what we and the administration understand to be community-based or protection-centered case management. So, like you said, there's an ORR system, Office of Refugee Resettlement system, for receiving, welcoming refugees who've been resettled into the United States. And helping them to start their new lives. The exact same, and we've actually recommended, along with many other NGOs, that ORR also have a program for receiving asylum seekers. The problem is the administration, again, kind of leans into those enforcement-centric approaches. So there have been, case management spins on basically what are surveillance programs. So, okay, we're not going to put you in, it's like we start on one end of the spectrum of detention. We're not going to put you in detention. So we will just, put a GPS monitor or ankle shackle on you and follow you in the community. And we will provide you some case management. But it looks more like a criminal justice system model, like a parole officer, a probation officer that you would imagine. It's not, something that is trauma informed, that is, community-based, linguistically, culturally relevant, et cetera. So I think the administration will fund some, case management outside of detention centers, but whether it looks like a law enforcement model or a protection-centered model is an unanswered question.
Thank you. That's really interesting. I mean, some of us are beginning to think whether it makes sense at all to think about pushing for ratification of the Convention on the Rights of the Child. Is this a good moment? Is it, probably doomed to failure, but given the emphasis on families and on children, this clearly would fall. The current administration, even policies, would completely fall foul of the CRC. So this is very interesting to hear what you have to say. So thank you. Yael, I wanted to kind of press you a little bit on this question of the exceptions to Title 42. So you said that there are some exceptions, and we've been hearing about that. We know that unaccompanied minors are coming in, as several of you mentioned. But then you mentioned these really heart-rending cases of, women with children being sent back with getting infections without clothing, and, just brutal policies at kind of a level of callousness, which is just unspeakable. So strategically, exceptions to a bad policy are a very mixed blessing, and you're always in this position of saying, well, this is the worst of the worst. This is bad, but it's not as bad as somebody who's got, not just cancer, but cancer and TB and, whatever. How do you think about that? And how should we think about that from an advocacy perspective? This whole question of exceptions, I find it very troubling because, it's a violation of international law. These people are entitled to make asylum applications. So by conceding and by working with them, if you like, and I can see the dilemma that humanitarian organizations face when you're confronted with some particularly compelling cases. but is this kind of being bought off? Maybe I'm putting it too strongly, but I would just like your thoughts about that.
Yeah, it's a fantastic question, and it does a couple of things that are extremely problematic. And first and foremost, the right to territory, the right to ask for asylum for everybody. I mean, that's sort of not even part of this, because the selection of these vulnerable folks would be done sort of on the Mexican side. So that raises all kinds of questions about sort of externalizing the whole process, externalizing a selection process. That's one problem, and then there's who's going to do that selection. If the U.S. is going to rely on NGOs to, are people with attorneys, to sort of suggest, highlight the most vulnerable, rather than the U.S. taking your sort of responsibility for this, and also putting that weight on NGOs to play God and to select people and to make that selection. And then there are, of course, at the heart of it, the vulnerability criteria themselves. And I mean, I actually think this is just, to just put a point on it. I mean, this is just the tip of the iceberg when it comes to how do we establish vulnerability characteristics at all. I mean, as we all know on this call, there are millions of people displaced, living in refugee camps all over the world, living outside refugee camps all over the world. And the people who get resettled and the people who get access, there is a selection process to all refugee resettlement. I mean, it's just a small trickle of people who meet, and the UNHCR has vulnerability. They've created vulnerability characteristics. Victims of torture, victims of severe gender-based violence. I mean, those people sort of raise to the top on the vulnerability characteristics. And it raises a good question in terms of, not only, for me, it's sort of like different countries. I mean, as a historian, maybe we should take people based on different ideas, based on US relationships with a home country. Maybe we should be taking people based on, how do we do this vulnerability selection? How do we select people we're going to give access? So you're right, the gatekeeping issues, it raises so many issues that I think are almost part of the way the whole protection system works in the world, period, but makes it even more pressing now because it's putting NGOs and people on the border at this very moment in time, in a situation that does not need to exist, because if we lifted this Title 42 policy, I think it could all be avoided. If I could just say one more thing to your question to Olga, I know I won't take up a lot of time, is that one of the things that shocked me when learning the history of the asylum system in the United States and our lack of humane reception is also, we don't actually appropriate money for adjudication of asylum. Not just a reception, but adjudication. It's like our USCIS system is fee funded. The people so I mean, there are so many ways that we are not providing resources to, facilitate an adjudication system and a reception system that's protection focused, as Olga was saying, and instead we're spending a lot of money on detention, and on enforcement instead. So, I mean, we really need to rethink how we appropriate money for these things. I just wanted to get that in there if I could.
That's a really important point. And as you point out, it's less than 1% of registered refugees who get resettled. And I think this whole question of both the scale of resettlement, now Biden has fortunately upped from 15, or was it 25, ceiling to 62,500, but still it's a drop in the bucket. So, this is a whole other conversation, which I'm glad you raised, is critical. So Eunice, in 1 minute, please, I wanted to ask you briefly, and it's very unfair to ask you this question, but forgive me, the Mexican government's approach. We know that under the Trump administration, the Mexican government sort of had a gun to its head in a way. So without exonerating your government, clearly they had very reduced options given the pressure that the Trump administration put on them in terms of trade and economic factors. Now with this new administration, you mentioned the militarization of migration, at the northern border, the US northern border, at the Mexico-Guatemala border, Honduras, and so on. How is the government now approaching this situation? For example, why doesn't the government say to the US, I'm sorry, we are not accepting people who are positive? No, basta. closed border. We are not a kind of a dumping ground for people who are making an asylum application in your family. Why does the government, are there still so many economic pressures on the Mexican government? Or why is the Mexican government not exercising a firmer and more kind of aggressive stance towards the blatant kind of abuse of power, I would say, of the US?
Thank you, Professor Baba, for your question. I think that the relation between the United States and Mexico have been unequal historically talking. And as you already remarked, we used to do that under Trump's administration because all the commercial treatments and all the things that we already know about the economical practices between Mexico and the States. But now the vaccines, I think, is one of the most important issues between our countries, and is the reason because we are maybe accepting not only militarization in our southern border, but also accepting these families, because it's not only that we don't want the people with COVID, but they are Central American people. So when Biden talk about deportation, this Title 42 is not a deportation, because they are not taking these people to their countries. They are taking these people to Mexico, and they are not Mexicans. So even under that criteria, Mexico cannot accept these people. No, I think that we have to think also on the people and all the context and all the vulnerabilities of these people, and we had to do something. But I think that it has to be like a solution between both governments. But I think that the Mexican government are doing that because of the vaccine. They are afraid of vaccines, that because they are negotiating. I understand they are negotiating now this issue with the United States, and is one of the points, the remarks they make, and because of that, they ask us.
Thank you.
Okay,
So I'm just going to, let me jump in. Sorry, I'm going to cut you off because we are running out of time, and I can see Carissa there. But Carissa, can I just ask the question that we have from the chat? Apologies, this is just such a rich discussion. So one of our audience members asked this question: does US population decreasing, as per the recent census, serve as an economic rationale for creating a humanitarian public health agency to properly receive asylum seekers, keep families together, and expedite green card and access to citizenship? So it's a really good question. We've seen the numbers going down, you know, and people talk about the demographic dividend of migration. So maybe, Olga, I'll put this in your court, but just literally in half a minute, please.
Sure. I mean, I think it's something that the US has not thought about as much as other countries, and maybe this new census data will push conversations in that direction.
Great, thank you. Wonderful. Okay, thank you very, very much. That was a very rich discussion for such a big topic in such a short time. And Carissa, I'm handing back to you.
Yeah, thank you. Thank you for everyone for joining us, and a special thank you to all of our speakers today, Eunice, Yael, Olga, and Jacqueline, for sharing your expertise and providing such a comprehensive review of both the historical and the current situation at the southern border in the United States. And thank you also for analyzing how the Biden administration can work to hopefully make long-lasting improvements to the immigration system in a meaningful way. We've really only begun to unpack these issues, as you can see, but I thank each of you for working in this space to improve these systems every day. And just as a reminder to everyone that joined us today, this recording will be available on the HDHI website in the coming days in case you weren't able to stay for the whole thing or you missed part of it. And so thank you all again, and have a wonderful afternoon or evening wherever you are.